Surgical AEC is to provide care for ambulatory patients, so there are patients that can walk in and be treated and hopefully be discharged the same day. Our patients on the ambulatory unit come from GPs, A&E and clinic areas. The purpose of the AEC is to treat people on the same day and get people home. EAUS is an admissions ward, so for those patients that come through our clinic and need a bed, they'll end up on our ward, and the patients that come from GPs and A&Es that are too poorly to walk into our clinic will be admitted straight to a bed on EAUS.
There's a kind of misconception that surgeons, the only thing we do is operating. Probably that's about 20% of my job. About 80% of the time is actually talking with patients, trying to work out what's wrong with them, coordinating tests, investigations, coordinating their care and their social care and getting them well and home again. And actually, quite a small part of that is the actual technical operating bit. That's the bit we all like doing, but actually that's quite a small part of the life of general surgery. There's no such thing as going home at 5 o'clock, 6 o'clock, whatever, and forgetting about it. That patient that's had that operation is still your responsibility, and we work as a team, so people will, pick things up for you. But ultimately, they belong to you until they've forgotten about their operation and a long way out of hospital. The commitment to that patient actually is quite long term. There's sometimes a focus with surgery to think it's about doing something and getting that person well and recovered and home, and that's obviously what we want. There are so many little elements to that getting that right does require lots of people to do their bit and lots of people's expertise to make that happen.
There's so many different roles within anaesthetics that you can get into, and it's difficult to really appreciate that in medical school really until you start working, unless you happen to be exposed to that. But actually when you start working you realise that in anaesthetics you're involved in so many different departments, so many different things, so you never quite know what's going to happen in your day.
I qualified as a diagnostic radiographer and decided to stay in plain film because it's very varied. We go to theatres, and we work in A&E, we work with inpatients, and we do a lot with outpatients as well.
So because when you're a theatre nurse, you only just see a patient who's asleep on the table, and then after that you don't get to communicate with them anymore. So what this role has given me is to see a patient from the very beginning of their surgical pathway up to the end. So we see them before they come to theatre, during theatre or during the operation, and then we get to follow them up in clinic afterwards. So that's what I really enjoy most, is the interaction with the patient.
Sometimes when there is an emergency situation and your adrenaline is kind of boosting, that's one of the most exciting things. And then it's kind of just good to reflect on those kind of things afterwards.
My role involves collecting patients and the day-to-day runnings of the theatre. The nurses can still stay on the wards and still do their job roles, and we were created so that we could go off, get the patients for them, set them up, and also be kind of a comfort for them as well. As long as you have a passion, coming into this environment is just... I'm very proud to work here.
The clip of an instrument, when an instrument clips close, I love that sound. Especially in emergency theatre, there's lots of times when we sit around and sort of wait for a patient, or one can come and they get changed for somebody who's more important or whatever. But then when things really happen, the whole team comes together, people come from everywhere to come and help, and it's just, you can work with people and there'll be somebody have your back especially when you're scrubbed. Lots of people will help to get the whole thing going, and I love that.
Surgery is quite amazing. It's quite an honour to look after patients post-operatively. There's a lot of things to think about. Every patient has a different story, a different reason to come in. They can be emergency, they can be trauma. It's almost very exciting. All the stuff, when I used to bank in accident emergency department, all the exciting stuff that came in there all came onto an emergency assessment unit, surgical, then they'd come in for surgery.
It's busy and it's fast paced, but that allows us to really support the teams that we work with, Typically I'll start my day with a ward round and handovers with both the medical team and the nursing team to make sure that everyone is happy with what's going on, and that if we have any problems or anything that anyone's worried about, it's highlighted early on in the day. Then it's my job to see as many patients as we have on the unit to make sure that we're using all of the medication for them safely and appropriately, and it's doing the right thing.
Knowing that I'm doing something, no matter how small, that is enabling all the medical staff, the ward clerks, all the clinical staff to be able to do their job without stopping halfway through and thinking I haven't got anything or I need this. Just doing that, and it is a big thing, because someone could say, I haven't got a tourniquet and I need it straight away, and you're able to run straight away and get it and give it back to them. And if that silly little things like that mean a lot.
I enjoy being in a unique position to try and make a difference. I work in an emergency surgery department, so by that very nature, the patients are usually quite poorly, relatives are usually quite anxious. So for me to be able to be in front of these people and try and help them and help with the communication side of things and just ease the whole experience, that is my favourite part of my job, making a difference.
I feel really inspired to do nursing, get into nursing, because I've been watching the nurses for the past year doing what they do, and I think it's just a very rewarding job to be in. I will hopefully be doing my HCA training soon to get into nursing. My mum and my nanny both work here, so I knew what it was like, and also Grandad was treated here, so I knew like the atmosphere was nice. I wanted to be one of those people who made people happy.
We use ultrasound and we produce diagnostic images looking at patients' anatomy. You get to sort of a dynamic real-time scan. You can also report on it. Most images that we take, whether it's CT or MRI or plain film, we don't actually give a sort of a diagnosis, whereas ultrasound, you work more autonomously and you sort of give a diagnostic report on that.
You get to make a difference in somebody's life when they're probably having a really bad time. So that's quite a nice thing on a human level to do. But also, the roles are unbelievably varied and wide, and the numbers is massive. You will never be bored, and the sky is the limit pretty much. You can do what you want to do, to be honest with you, yeah.
We see some patients with spinal cord injuries that have come from a major trauma, and this is obviously a life-altering situation, and to see some of them make the progress that they do, you spend a lot of time with them, and it makes you feel really good, and that actually all the hard work getting to that point to become a physio is definitely all worth it.
No doctor could do anything without all of the nurses. Like the HCAs do all of the care for the patients, wash them, dress them, all of that side of things. The nurses give all the medications that we prescribe, and being able to get advice from those people about how they feel about the patients is really important as well, because they spend a lot of time with them, whereas we might not be able to. So being able to work in that team and get a lot of support from everyone is my favourite thing about the job.
A lot of my role is reassuring people that you don't have to know everything. You've got a long career ahead of you, and you will learn and gain experiences as it goes, and that from the very beginning you've got other people around, you've got a team around you. A lot of what we do is talking to people, getting information from them and using that to help the doctors diagnose the problem. A lot of nursing, I think, is about common sense. So there is a lot of theory that we do have to learn, but a lot of it, putting it into place, is actually about being organised and logical and having that common sense that something's wrong and that you need to get help and escalate it.
I feel that nursing is a fabulous career. I feel very privileged to be a nurse and to be able to support patients in the way that I've been able to throughout my career. Patients come to us very vulnerable, and they want safety and security, and it's our role to make them feel safe and secure in our environment that they're completely unfamiliar with, and it is a brilliant career for anybody wanting to join.